Hi, my name is Jessica Tapusoa. I am one of the nurses here at AesthetiCare. Today, we're going to go through INTRAcel from top to bottom. I'm going to explain how it works, why it works, who's a good candidate, and what your downtime looks like. INTRAcel is such a popular treatment because you don't have a lot of downtime that you would have with one of our more ablative lasers. Therefore, it's a good treatment to do several times a year. My model here has been numbing for about an hour, so anytime you schedule an INTRAcel, whether it's for the face or the body, we're going to have you numb for about 45 minutes to an hour before the treatment. So I'm going to go ahead and get started here. As I do the treatment, I'm going to explain everything just so she understands and just so you guys understand as well. Now we use a 23% topical lidocaine to numb. This treatment would not be very fun without numbing. However, we do have another alternative besides lidocaine. It's called the Pronox. It's a nitrous gas. INTRAcel is one of those treatments that is good for almost any concern you might have for your skin, whether it's laxity, texture, pigment to a degree. It's good for pores. On the body, we use it a lot for stretch marks and scars as well as laxity. It's very important that I get all of this lidocaine off because we want clean skin when we start. We use a basic face wash. With our model Ellen today, we are going to do full face and neck. Next, I'm going to do a pass of just regular alcohol. Again, we just want to make sure that we get all of the lidocaine off. Be a little stinky, a little strong. One of the best things about INTRAcel is that you can do treatments during the summer. We don't want you to ever have a sunburn, but you can do it while tan. And as always, after treatment, we want you to practice safe sun, lots of sunscreen, hats. All right, so in a nutshell, what is INTRAcel? INTRAcel is a microneedling procedure that incorporates radiofrequency. INTRAcel is such a popular machine because we can switch between two different modalities. We can switch between bipolar radiofrequency and monopolar radiofrequency. Monopolar radiofrequency is the most popular version because that's what we generally use for tightening. With this machine, the tip incorporates 49 needles. When the needles enter the skin, it emits the radiofrequency, which in our industry, we just use it for a lot of heat, okay? So you get the mechanical injury of the needles breaking the skin, and then you also get the thermal injury of the radiofrequency once the needles are in the skin. We're going to go ahead and start here with Ellen. I'm going to start very superficial on the forehead, just because it is a more tender area considering we're treating right over bone. Ellen, in her hand, has our grounding pad. That's what is able to pull the energy a little bit deeper so it doesn't just stay on the top. Therefore, we are affecting and reproducing more collagen. We're going to keep her at a high level. And when I say high level, I do mean this is a pretty aggressive version of this treatment. Start right here in the middle of her forehead, okay? Ellen, you know the drill. If you need me to stop or slow down, you let me know, okay? Here we go. 1, 2. With INTRAcel, there can be some pinpoint bleeding. That is expected. The good news is you will not have any bleeding after you leave us. INTRAcel is good whether it's a corrective procedure. For instance, maybe we're treating acne scars on the face, maybe we're treating scars in general, maybe it's those deeper wrinkles or just general laxity. That's what we call a corrective treatment. In that case, we might do a series of anywhere from 2 to 3 to 5, depending on the person and the severity. We like to space those out at least a month apart. Sometimes we'll even go up to 6 to 8 weeks in between. INTRAcel, however, is fantastic because it can be one of those basic anti-aging treatments that just in case or maybe you need a little pick-me-up, your skin's just feeling dull. Hitting here on the side, very popular for hitting those crow's feet. Radio frequency is so popular because we can get right up to the eye and we don't have any chance of scattering energy. It's also why she doesn't have to wear any kind of goggles. This is great for all of those fine lines and wrinkles around the eye. All right, so I hit this side of the forehead and the cheekbone. I'm going to come back and do this side of the forehead and the cheekbone. On a scale of 1 to 10, Ellen, what are you feeling right now?
Maybe a 2.
Okay. So again, that lidocaine really helps to keep you comfy. Another huge benefit to INTRAcel is we can treat any skin type. We can treat light skin all the way to dark skin. You'll notice the areas that I've already treated, they'll start very slowly to turn red. So when we are finished, she's gonna have a general all over pink color to her face and neck. Depending on how aggressive we get, she can expect that pink, that redness to linger anywhere from 12 to 24 to 48 hours depending. Post-care with this treatment is real easy. We will send you home with a complete kit, everything we want you to use. We send home a gentle cleanser. We send home the moisturizer, which is a basic CeraVe. And then of course, sunscreen. All right, since I'm still at this shallow depth, I'm gonna go ahead and treat the bridge and the sides of the nose. Kind of marry everything together. Remember, this is great for pores. So if somebody has a lot of enlarged pores around the nose, you can get pretty aggressive and do multiple passes. All right, so now that we're done with those areas that are very close to bone, I'm going to increase my depth, get a little bit more aggressive for the lower face. I'm gonna have my patient turn to the right. We're gonna treat the whole lower face and then full neck. Again, the pinpoint bleeding is totally normal. We expect it. Very popular again for around the mouth on those vertical lip lines. You can even treat directly over the lip. Helps to build collagen there. The lower face is probably the most common area along with right under the neck, just because it's great for tightening up all that loose skin that generally comes with aging. For those of you who have tried Exelis or any other form of radio frequency before, I highly encourage you try this. Just a step above, a more aggressive version of it. Now with INTRAcel, you can break treatments up however you want. We could do just the forehead and eyes, we can do just the lower face, we can do just the neck, or you can do it all. I'm gonna go ahead and complete my first pass on the lower face and neck, and then I'm going to come back and do what we call a crosshatch. Just means I'm gonna throw another pass in. Always paying special attention to any problem areas that the patient might have. All right, guys, I'm gonna start my crosshatch now. Following the same pattern, just gonna head a different direction. All right, so I'm just kind of looking at her, make sure I didn't miss any areas. She's got a nice even tone to her. So we're gonna go ahead and just turn, finish on the other side. skin, we're seeing that erythema show up. Very nice, very even. And depending on your skin, again, some people will go home by the end of the day, they could look completely normal. Some people like me who have a more sensitive skin can be red for a day or two. The good news though with post-care with INTRAcel, tinted sunscreen really helps to cover that up. It's also safe to wear a good grade mineral makeup. There's no working out for the first day or two. We don't want to do anything that would possibly introduce infection to the area. So no lakes, no swimming, no hot tubs. All right, I'm going to come back and cross hatch this last time on the neck. People who tend to swell, which is, it can happen, definitely around the eyes. Cold packs are always an option. The skin can just kind of look a little puffy immediately post-treatment, but that tends to subside fairly quickly. All right, I'm going to come back and cross-hatch on the face, and then we will be done. All right. Now, I'm going to clean her up. When we do any kind of ablative treatment or needling treatment here at AesthetiCare, we always give the option of adding growth factors immediately post-treatment. We can either draw your blood, spin it, reapply your own platelet-rich plasma, aka PRP, and send you home. We also have another product that is known as Core, that is 99% human growth factor that we can put on your skin immediately and send you home. Helps with the inflammation, helps with healing times. With both products, that's where all our growth factors are. So the fact that we had just treated her, those channels are open, therefore they're more accepting to products. Those channels, as a general rule of thumb, are open for the first 45 minutes before they start to really close up and heal, start to heal. All right, so we're going to go through post-care just one more time here, a little bit more thoroughly. In your take-home kit, there will be written instructions, so there's always a reference if you need it. Anytime you wash your face, still wash your face morning, night, or if you feel like maybe you did some sweating when you went to the grocery store, whatever it may be, then I would encourage you to wash your face as well. It's a gentle gel cleanser, so it's going to work great for everybody. We're going to use fingertips only. No washcloth, no Clarisonic, no exfoliating, and no scrubbing. We want to give this a nice gentle healing ground. After you wash your face, we're going to do just that basic CeraVe. It is a moisturizer. It is oil-free, so we don't have to worry about it causing any kind of breakouts or congestion. You may have to reapply the CeraVe multiple times a day just to ensure that the skin is well moisturized. And again, we're going to send you home with a nice tinted sunscreen. It'll help cover the pinkness, but it's also a great mineral-based sunscreen that we know is going to be top of the level at keeping your skin safe while it heals. If you do have to be out in the sun, obviously we want you to be very safe. Think about hats, think about umbrellas, think about, reapplying your sunscreen every 2 hours at least. After about 3 to 5 days, your skin may start to look more like normal, and it can get a rough texture to it. That's normal. Just don't try to scrub it off. Let your skin heal by itself. Once you feel like your skin is back to normal, I would encourage you to take maybe your normal product routine. Do a test spot. If it stings, we know it's too soon, your skin's still healing, continue with the CeraVe. If it doesn't sting, then that's pretty much a green light that you are good to go. Again, INTRAcel can be done as soon as every month, every 6 weeks. If it is a corrective treatment, if we are targeting something, whether it's pores, pigment, acne scars, whatever it may be, then we're going to always encourage a series of treatments, generally anywhere from 3 to 5 depending on the person and depending on the severity. Excuse me. We are also encouraging this for just a great anti-aging treatment throughout the year. This is something that we always run a special for during the summer, so it's very popular. You can always have a tan. Again, we don't want you to be sunburned and come in and try to get this treatment. So if you're interested in INTRAcel, I would highly recommend you calling. We do offer free consultations as always, and we will be happy to put together a game plan for your skin. So we just finished up our full face, full neck INTRAcel treatment with Ellen. We just wanted to give you a little look at what she looks like immediately post-treatment, and also so you can hear from her experience about her whole treatment today. We had her come in, she numbed, we used a topical lidocaine. From there, as far as the treatment goes, kind of tell us what you felt.
To be honest, I don't really feel a lot. I just feel a little bit of pressure. There's very little pain or discomfort through it, and I've done it in the past and love the results.
Sure.
I feel like in the next 3 months I'm going to see more and more. My skin's gotten tighter and it's taken years off my face and neck especially, and my face, and excited to be here to be able to do the treatment.
Since you have done it before, can you kind of explain to us how easy or how convenient the post-care is?
Oh my gosh, it's so great. Today I'll work from home. I'll put the lotion on when I get home, the moisturizer, and work from home by tonight. Nobody will even be able to know I did it personally. That's I know everybody's different, but I don't really have any downtime, very little.
Great. We can't wait to do another treatment.
Yay! Thank you, Jessica.
You're welcome.